Okay, guys, MP Clark here with the morning coffee. We're back with part 4. So part 4, I think we are going to discuss follow-up, right? So follow-up is going to have a couple of different parts, but we'll just name this part 4 follow-up. So on follow-up, in the last video, integrity, that also kind of leads into follow-up. When a patient has a new medication, we all know that we're supposed to be monitoring that patient for at least 72 hours, right? To see if they're having any allergic reactions. Is the medication working? Is it not working? Is the patient saying that maybe it's making them feel funny, or it's changing their appetite, or they have a funny taste in their mouth? Things like that. Or maybe the patient went out to a cardiology consult, or any of the specialty consults, respiratory, urology, whatever. And then oftentimes they'll come back with orders for labs and or other follow-up appointments or procedures. So doing that follow-up, it's important. And I know this sounds like, man, there's not enough time in the day. There's not. But guess what? That's the reason why nursing is 24 hours. But if you are not prepared, right, to perform and working efficiently, and then we went into having integrity about your job, and now you have to do the follow-up with all of those pieces. This is just another piece. So with your integrity, let me leave integrity in the past. I'm sure we'll be back there. However, but the follow-up, it's important. You don't know how many times that I get labs relayed. Just a couple of days ago, I got a text from a nurse, and the nurse it was basically a renal panel, like, for the kidneys, right? And so I asked, why were the labs run? Well, I don't know. I don't work with the patient. I was told to relay the labs. But that is part of relaying labs, guys. You got to know what's going on, because I don't know why the labs were ordered. So, and making sure who ordered the lab. Somebody sitting somewhere, and that ended up being my response to the nurse, that, hey, look in the order, look in the progress notes, look at your schedule to see, did this patient go out and see a nephrologist or whatever? Because if you look at the lab, you can tell who may have ordered it. Sure, primary may have ordered that. However, there was nothing, any other lab. It was only about the kidneys. So in my mind, as the nurse, I have to think then, someone that is affiliated with the kidneys. They end up finding out it was the nephrology nurse practitioner who had ordered these labs, but the labs again were 3 or 4 days old. However, I instructed the nurse, my only order was to follow up with the nephrology MP, who then ended up putting a plan in place for the patient, and the labs were actually expected, and they were showing improvement. However, myself as the primary MP, had I gotten involved, I was going to, order this, that, and the other, based off false information from the nurse, because they didn't do a follow-up, right? So again, guys, this is about you having integrity and doing the proper follow-up. I don't ask you any information on a personal level. I'm asking for the benefit of the patient, but also because I've been on your side before, to protect you and your license, because we're all in this together. We're a team. So also with follow-up, I know there's times where patients will go home with families, or let's say I got this message this morning that the patient's family said the patient had a thyroid issue in the past. And so the nurse said, hey, do you want me to add the diagnosis of thyroid issue? So I said, well, what kind of thyroid issue was just the basics. If you don't know anything about thyroid issues, was the patient fat or were they skinny? Because those are going to be the two extremes. That way it gives us a little more guidance. And in the meantime of collecting information, because there's some more questions even you as the nurse should be asking when these things are being reported to you for follow-up. I of course instruct her, hey, let's send the patient to endocrinology, because they're the specialists in that. But in the meantime, we can do a thyroid panel to find out, and then go and assess your patient. Is the patient having, like brittle looking hair and certain things that we would expect from thyroid issues? But again, This is follow up for you. If you are not, if you're not well versed in thyroid issues, maybe you don't have time during the day to look it up, but after work, it's something that you should look up, right? Because you're following up for the patient. You need to educate the patient on what kind of things they're going through, right? Maybe the patient's really, really skinny. So there's a level of education that you have to be able to do. But if you don't know it, you can't educate them on it. So that's another thing with follow-up. Maybe you were here on Monday and there was some labs that were ordered because something was going on with the patient and you're off Tuesday, but when you come back Wednesday, that still requires a follow-up. Were the labs carried out? Were they relayed? What happened? Has the patient improved? Have they deteriorated? All of these things, guys, are in follow-up, right? When you have a new patient that comes to your facility, that requires follow-up. And that follow-up is oftentimes looking through that chart. And maybe you don't have time to do a complete chart audit, but looking back through that hospital documentation. I used to love reading the physical therapy notes because what we all nurses know, physical therapists, I have no idea why, but they're nurses in their previous life. That's what they believe. So they document a lot of information that is helpful to you. Also collecting collateral information, collateral from the family members, and things like that. So that way, maybe this patient used to work nights for 50 years. So what do we expect? The patient's going to be up at night because they've worked 50 years up at night. So it should not surprise us if we see that the patient's having falls at night. This is something to note. All of that information, to me, is considered, it's follow-up, right? And letting the other shifts of nurses know the things that they can kind of expect with these patients as well. If, I've had patients come from the hospital and they have a diagnosis of diabetes, but there's no medication. So when you received that patient, there should have been a call back to the hospital to find out, was there a reason why? Ask the patient. If they're not unable to speak, who's the next of kin, the power of attorney, the surrogate decision maker. But to find out, then obviously there's some labs that go with that. Well, let's check a A1C. So when I call the provider to say, hey, you have a new patient and this is what's going on, all of those diagnoses from the hospital should have a medication with it, unless it's a history. And then we note that. And then also, but in reporting that to the provider who has no access at this point to any of this information, then you're providing this information so they can make a better decision, which ultimately helps you again later on, in your working with this patient. Makes your shift go easier to know that, hey, this patient is diabetic, and maybe that's, why they're cold and clammy this morning. So, but there was no orders. Maybe the orders got missed by the nurse who did the admission. But doing that follow-up, anytime it was my first time working with a patient, I always like to go back through the hospital records quickly. I didn't take a full shift to do it, but just quickly skim through it. Look at things that may have been of concern. What were they in the hospital for? In the last couple of shifts in the hospital, were they given Tylenol? Why? Because that indicates they were trying to, I don't want to say cover up, but I am going to say cover up that fever so the patient can still discharge, right? So now what will I expect in the next couple of days? The patient might be confused because there's an infection brewing. So on admission, that's why as a provider, I always order a CBC and a UACS. Always, it's a baseline. So that way I can capture that. Why? Because it's less work for you and it's better care for the patient. Not everybody will agree with that, but that's just my protocol for my license. So that's what I do. So this has been part 4, I believe. I'm trying to keep these straight. I think I'm going to have to write this down after this. But part 4, follow up. And there's more that we can talk about. And as time goes on, as I make a few more videos, hopefully I'll be crossing in and out into some of these sections. But again, part 4, navigating the nursing home. So this has been follow up. So this is MP Clark with another cup of the morning coffee.